And our health guru, Stephanie Butchara, joins us now. Stephanie?
Did you guys know that annual pap smears may actually not be necessary?
Oh.
I have the details. Once a year, women have been visiting doctors for their pap smear test, but this may no longer be the case. That's right, annual pap smears are no longer necessary. The U.S. Preventative Services Task Force released new guidelines extending the time between these cervical cancer screenings. Medical experts say women should undergo screenings every 3 years and not for shorter intervals.
It really does take years to see changes, and that it's highly unlikely to see changes from year to year when you've had a negative pap smear already.
The guidelines also recommend that women under age 21 and over 65 with a clean pap smear history shouldn't have to be tested at all. Regardless, experts say that any women with concerns should talk to their doctors about their individual risks and find out if they benefit from more or less testing. One good thing may lead to a bad one. Cholesterol-lowering pills may lead to a greater risk of diabetes. New research shows drugs such as Lipitor, Crestor, and Zocor cause an increased risk of raising blood sugar levels and provoking type 2 diabetes. The FDA recently started requiring drug makers to put a warning label on the popular pills. Medical experts say the data shows that about 1 in 200 patients who took statins developed type 2 diabetes.
When you start to think about that there's 20 million people taking statins, predominantly the more potent ones, that could be 100,000 new diabetics.
Lowering the dosage of these pills is a possible solution, as diabetes was not seen in patients that took smaller quantities. Regardless, doctors say more research is needed, as the actual cause of the increased risk is unclear. School districts across the country will soon be able to choose what type of ground beef they want to serve in their cafeteria lunches. The USDA made that announcement today as controversy grows over the use of an ammonia-treated ground beef filler known as pink slime. Starting next fall, schools involved in the National School Lunch Program will be able to choose between serving 95% lean beef patties made with this filler or using less lean bulk ground beef without it. The change is not expected to kick in immediately because of existing contracts.
So, Stephanie, what are the dangers?
Well, the department actually affirms pink slime as being safe, but we must not forget that this is the same product used to kill bacteria such as E. coli and Salmonella.
Oh, wow.
Okay. Thank you, Stephanie.
And it was a beautiful day, and then all of a sudden there were storms outside.
Tyler Welt joins us next to see if we can expect the same stormy evening we saw yesterday. Stay with us.